Everyone. Welcome to another session here at ASTHO's COVID-19 Tech Expo. It's a pleasure and honor to be here today to moderate this session as it relates to vaccine credentials. My name is Zeeshawn Chughtai. I'm an analyst in the data analytics and public health informatics team here at ASTHO, here with an amazing group of experts here to discuss this very important and timely topic. And as just a bit of an overview of this session from paper to digital, the evolution of the vaccine credential, as we all can appreciate, as more Americans receive vaccinations, safely reopening communities will soon follow. We have air travel, sporting events, concerts, and other activities that will accompany a gradual reopening phase. And vaccine credentials, such as mobile applications or digitally signed paper cards, will be essential. Now, in this session, you'll hear from our public health technology partners and how they're working to help jurisdictions develop digital vaccine credentials, vital to a successful vaccine administration campaign. Now, vaccine credentials are on the way, but developing them won't be easy. That's why we have this wonderful panel here today to host this discussion. So I just want to introduce the panelists here. We have Kevin Richardson, our first expert today, has the benefit of both public and private sector experience. He serves as the outside counsel on global government affairs for Zebra Technologies Corporation, and he also serves as an elected official as the mayor of the village of Lake Barrington, Illinois. He's also the president and managing director of the Heartland Solutions Group. Next, we have Karen Gardner. Karen is the chief marketing officer of SICPA and represents the Vaxtrac coalition. She brings nearly 30 years of expertise in developing and executing market-driven business strategies, product portfolios, and engagement programs for technology companies. And last but not least, we have Ramesh Raskar. Ramesh is an associate professor at MIT and the founder and chairman of PathCheck Foundation, offering COVID-19 digital solutions as it relates to exposure notifications and vaccine credentialing. In his former role at Facebook, he launched and led innovation teams in digital health, health technology, and other focus areas. So thank you all for joining us today and having this conversation. I really do appreciate it. It's going to be a conversation, definitely we'll make sure of that. But to set the agenda, what we'll do is we'll start with 5-minute remarks from each panelist. Then we'll open the floor for panel discussion, have an audience Q&A after that, and then we'll wrap up with any final thoughts or questions. So to begin, I'm going to turn it over to Kevin to start us off.
Terrific, and thank you for the chance to be here and to be with all of you. Before I make the comments, I want to say to all of the ASTHO members, and I've been mayor for 16 years and I was on council for 6 before that. I want to say thank you for your service to the public. We've been in an emergency situation for well over a year, and the demands upon all of you have been extraordinary because I've seen it up close and personal in my own community, in my own county. I appreciate and value your service, and you've done an incredible job serving America. You know, I also want to thank the ASTHO staff for inviting me to participate. I congratulate them on assembling a well-balanced panel, 2 experts and a politician. When we conclude, I can take comfort in the fact that all of you will have heard at least 2 worthwhile presentations. And I think I was probably set to go first in the spirit of let's get it over with. So with that, I'll get started. May I have the next slide, please? Thank you. There are 4 key considerations that I think are relevant to the discussion about credentials. They're there, won't read them to you other than to say that security and privacy are certainly essential to public confidence. Will it work? Privacy and equity are important to acceptance. Is it something we can embrace? And machine readability is key from the perspective of performance. I did 2 quick maps for this presentation that I want to go to next. First one, if you would please, next slide. This slide catalogs the key buckets of activities. I want to focus on just 2 of them, what I call the red box and the green box. May I have the next slide, please? The critical issue that ties, whoops, go back. Thank you. The critical issue that ties the red and the green boxes together is the linking of the vial to the patient so that a digitized data set of the actual vaccination event can be created and enable the subsequent certification accurately. I have great admiration for the creation of the vaccine administration infrastructure that's been built in the last several months. And I think it's appropriate to try to build on it by incorporating things like automated data capture and digitized workflows as soon as possible in the process as a way of making sure that the red box can speed vaccinations, reduce errors, and then set up the green box around credentialing for greater success. National Public Radio did a story earlier this week that talks about something all of you already know, namely we're in a race between vaccination and variants. Despite the remarkable progress the country has made on this, variants continue to pose a threat. This week, 34 states have infections going up. Positivity testing is up in 38 states and hospitalization is up in 20. So adding additional capabilities to the red box as a way of assuring acceptance and effectiveness of the green box is going to be very, very important. May I have the next box, please? Next slide, please. When I tackled this issue as an elected official, and I had no background in public health before any of this, I decided to reverse engineer it. And so what I've done is I asked myself, so what do I need to do immediately before this in order to achieve it? And then that's how I found the connection between the red box and the green box and what it means for vaccine credentialing. May I have the next slide, please? So if I want to get people back to work and eliminate the virus, I have to safely reopen the economy. Next slide, please. In order to do that, I need to create credentials in a couple of forms to address security, privacy, and equity. Next slide, please. In order to do that, those credentials have to be designed to assure that those things are respected and fully understood and addressed. You'll notice there are two call-out boxes in green: smartphone app and secure physical card app. The other speakers, I'm sure, will go into detail around the smartphone-based apps. I'll make a comment quickly from the secure physical card perspective because that's what Zebra is got a lot of experience in. You know, a secure card with a barcode or a QR code does not lend itself to being tracked. And secondly, secure cards can also accommodate important equity concerns, as not everyone always has access to a smartphone, but still has a need for a secure credential. Next slide, please. If we're going to do that, then we need to digitize the data sets so that those green box activities can occur of credentialing. Next slide, please. Before we do that, we need to make sure that we design the sites correctly. The red box needs to prioritize the digitization experience. The next slide, please. While I apologize for the rapid progression here, the point I guess I want to stress is that when I reverse engineered this, I found that starting from the perspective of minimizing paper workflows and automating data not only made the throughput and the performance of the vaccination centers more robust, it also set the stage for very effective post-vaccination credentialing. Last slide, please. I won't read all of the balancing act. I've touched on these issues of the policy considerations. I would simply say that in the interest of time, I would be delighted to go offline with anybody attending this session. The ASTHO staff certainly has my contact information, and I bring both perspectives. I've been with Zebra as a tech company for a long time, and I've been an elected official for a long time, and I understand the intersection of the two. Thanks so very much.
Thank you so much, Kevin. And next we'll have Karen to share her remarks.
Excellent. So I think I need someone to start my video. Oh, here it goes. Perfect. Hi, everyone. Thank you so much for joining us. And to reiterate Kevin's points, thank you also for all that you have done, because this has been unprecedented and really one of the greatest crises I think that we've dealt with in this generation. And the progress that we have made is tremendous, right? So if you look at, this has been a year, it's been a challenging year, but we also have, seen ourselves kind of move from being able to identify, the virus and the infections, treat the virus and the infections, manage the contact tracing, update the public health systems, the immunization information systems to support some of the recording and reporting needs. So there's been a ton of great progress made. And we have the vaccines out in the market. I got mine this morning, so I have my little card. What I thought would be helpful to share, just as a sort of intro point before we get into discussion, is a little bit of background on SICPA and why we are involved in, or really even stepping into, the work around COVID and the health credentials that are being discussed today. So SICPA is a privately held Swiss company. We've been in business for almost 100 years now, providing document security technologies to governments. And in those technologies, we provide for the ability to ensure that counterfeiters can't counterfeit, right? They can't make the fakes, they can't tamper with documents, and that those who need to verify can indisputably verify the authenticity of something. So SICPA works today with about 95% of the world's currency, as well as identity documents for people and things. So the majority of the nationally issued passports, identity cards, state issued driver's licenses, all use features that SICPA provides to enable trust, right? To really ensure that trust is prevalent. And so if you go to the next slide, there's a couple of key areas, right? So trust in the asset value. When you're holding a $100 bill or any of the US currency, you can usually tell that this is a legitimate bill, right? And so there are features that are designed into that to make it very easy to confirm it. And you feel confident that you're holding a legitimate $100 bill. And if it feels a little different, you're going to question that. So that's an excellent example of something that's instantly recognized as valid. The next thing is really the trust in the origin of something and knowing where it has come from, whether it is pharmaceutical products, and knowing which manufacturer it came from, that it's legitimate, it's not coming through the black market, it's going to be safe to consume and effective, or passports and driver's licenses and other kinds of credentials that we know were issued by a government authority, and I can trust that this is the individual that is standing in front of me because of some of the different features that have been built in to also ensure identity proofing, right? So that you can tell that this credential was issued to the person who's now presenting it. And then trust in the integrity, right? So knowing that you have the legitimate products with tamper evident seals that can guarantee that this has not been replaced or altered or messed with in some way. And then really the cryptographic solutions and the data integrity, which is critical to the content in documents or in smart credentials, which is certainly one of the angles that will be an option for vaccine records, test results, other kinds of credentials and assets that we might be relying upon. So why is SICPA interested in dealing with the health credentials and vaccine passports, for those who call it that? But really, I think it is a health credential. And unlike, or really like any other credential, right? The more the document gains in value, the more needed it is. So if it is going to be required to have a negative test result or a vaccine credential to travel, then you're going to have people creating fraudulent versions, trying to work around the system. And we immediately saw that, right? PPE, when the demand spiked for PPE, you immediately saw fraudulent substandard materials being brought into the market and flooding the market. We'll see that with vaccines in markets where the demand is high and the supply is low. We'll see it with credentials if people need to have them and can't easily get them. So if you go on to the next slide, one of the challenges with the current credentials, we have the current yellow card that is authorized by CDC and the WHO, which is being used for international travel. It's required today for many countries in Africa, Latin America, and is heavily frauded, heavily counterfeited. We have, I think, experiences where you can buy a pre-filled out yellow card with all of your information for $5 at the bus station, right, as you are going to move from one market to another in Africa. And we haven't really needed to deal with these types of credentials within the US borders because of the strength of the public health systems that we do have in place. But when something like COVID comes along, we do have a need for some of these kinds of credentials to support verification that we are properly addressing the health needs, both from an individual's continuity of care. Do I know which vaccine they received, when they received it, when's the booster shot due? Is there a way to automate and help support the reminders and the follow-up that's needed? So there's downsides that come up when you're looking at paper-based credentials that don't have automated processes and data behind them. So I think, as Kevin highlighted when he reverse engineered that process, there's a real benefit to having the ability to bring the data set directly into digitally secured credentials, whether they're presented in a digital format or not. So if you want to click ahead, looking at what do we really need in credentials going forward, certainly there's an opportunity to leverage data and data sets, and importantly, trusted data sets, to ensure that we can verify someone's test results, someone's vaccine status when it is needed. And that's really a decision, and there's a lot of political discussion around, when and where we might want to check for or require either a negative test or a vaccine. Certainly we've seen with entry into school, vaccines have been a priority to help to manage our community health. We will see it continuing with travel. We may see it in some situations where we're trying to accelerate that return to normal more quickly and ensure that we're doing it safely. But these types of credentials need to be trusted. They need to be immutable, meaning they cannot be tampered with or faked. They should be privacy preserving and inclusive, so that anyone has access to get their own credentials in their hands and in their control, where they can leverage them to support their own follow through on health, but also to provide for the equity in access when it might be required to have a vaccine or a test before entering a facility, before traveling. And having it done with the digital back end allows for that automated verification process. So no individual who's on the verification end has to be educated to know, how do I verify this credential is legitimate and from a legitimate source? And how do I know that the vaccine that has been administered is one that's accepted in our market, right? So there's a lot of different data points that can be built into a digitally secured credential with the flexibility to be issued on a piece of paper, in a travel card, in a smartphone app. So that flexibility really helps with addressing the whole population's requirements. And so if we go forward to the next slide, SICPA has partnered with a number of other organizations. So we're experts in verification and anti-counterfeiting, in identity documents and credentials. And we've partnered with a number of other organizations who bring different types of expertise to the whole process of managing vaccination, from the tracking and delivery through to the identity and verification of the healthcare providers who are administering those vaccines, and then into the process of actually managing the recording of a vaccine or a test that might be administered, so that it can be leveraged or managed, behind the scenes as the electronic health records, but also for issuing of credentials that can then be leveraged and verified on the other end with appropriate tools to support the verification of that credential, and where appropriate, build in the business logic into different types of apps that would support decision-making without expertise, right? So you can have a verification app like the iCheck app that we have that checks the credential, but also checks it against business logic that might be required for a certain country that you're traveling to. So this whole solution was actually started with work to modernize the yellow card in Africa, well before COVID actually even started, and COVID really ramped it up and said, okay, we need to put greater focus on this overall tool set for those markets that aren't prepared with the underlying infrastructure, but then for the markets that already have the underlying infrastructure, provide the modules or the capabilities that fill the gaps that might exist. So this has been built out where it is modular components. So let's say immunization registry or the immunization information system in a state is the system of record for vaccinations, which is the case in how we've set this up in the US. It's a great place to start from for the administration of credentials when an individual needs them. And so you've got the system of record that has the information on what vaccine someone received, when they received it, where they received it. It was administered by an authorized healthcare provider. So I've got some trust and integrity in the data. And if you can then issue those credentials directly from the IIS system or directly from an electronic health records management system, you have a tool set that is trusted for the needs where you need to be able to verify, but it's also a tool set that is able to support the continuing care for individuals. So I will wrap up. I think I've gone a minute or two over here. And thank you so much and look forward to the discussion that follows.
Not a problem, Karen. Thank you so much for sharing your perspective. Really do appreciate that. Next, we'll be having Ramesh to share his insights and thoughts as well.
Thank you, Zeeshawn, and Karen and Kevin covered it really well. I'm a professor at MIT and also founder chief scientist at PathCheck Foundation. And PathCheck, which is a spin-off from MIT, has become the world's largest open source nonprofit for COVID-19 software. And it's already the official exposure notification app in 5 US territories, 5 US states and territories. Next slide. And that has been a humbling experience of how do you work with states and various stakeholders as we deploy solutions that are really facing the residents. So what I'm going to really talk about is, instead of a complex ecosystem of vaccine credentials, something that's just a minor upgrade to the CDC vaccination cards. And I have one in my hand right now. And the idea is that it's a trifold. From the outside, it just looks like, just instructions. And when you open it, inside, you have a QR code that is a digitally verified signature, digital credential of your vaccination journey, your first dose, second dose, whether you have a voucher to get vaccinated or not, and so on. And you can close it and have a selective disclosure when you want to go to a pub or travel or go to a school. And it has another QR code that you collect that's also digitally verified, which just says, I'm Ramesh Raskar. It could be just RR, my birth year, just 4 letters. And when it is valid. And if you want, the traditional card, then in the middle, you can just write your whole name and all the rest of the information. So have kind of a notion of a private disclosure. And we want to thank IDEO for proposing this design. Next slide. So the way to kind of think about the space of vaccine credentials is, on the vertical axis, we have the consumers. And the horizontal axis, we have the issuers and verifiers, but especially the verifiers. And as Karen said, on the bottom left is we have paper, which is for human verifier. But we can upgrade that to something called paper credential, which is what we have proposed at MIT. And this is an offline modality, which means, of course, the paper carried by the resident is offline. And how you verify it can also be an offline app that doesn't have to be connected to the internet. There is no blockchain, there's no electronic health record, there's none of that complexity. Now, some other organizations are proposing online credentials where the consumer has to be online. They need a smartphone, and the verifier also has to be online because they're going to check everything in real time. And that involves either checking the verifier on blockchain, or looking up their electronic health records in real time, and creating some kind of an audit trail. And somewhere in between is the space of offline app-based credentials, where you might have your wallet or map, and it might update intermittently on your phone and can be checked by an app. So I'm mostly going to stick to this yellow box of offline credentials. Next slide. Now, when we think about vaccination, there are many challenges. Eligibility, dosing, connecting the first dose to the second dose, entry permits, which is what we're talking about here today, and also reporting reporting adverse side effects. All these 4 steps actually require verifiable credentials. not just the third step that we are talking about here. So what we have done at PathCheck Foundation is created solutions for all these 4 stages of a user journey. Next slide. So the way to think about this ecosystem is in the middle, you have an app for the health system, health ecosystem, or an app for the venue, which we call Veriscan. And it talks on the left side with state IIS systems, or WARE systems, and WAMP system, and so on. And on the right is the user option. The user might have just a paper card, or they might get SMS-based interactions, or they might have another app we have launched called Boost 19, which is a full-page vaccination journey app. And the idea here is that, here I'm talking about the MIT SafePaths paper cards, but in fact, it could be any paper card. It could be the Israeli one, it could be a British one, it could be the New York one, or it could be any one of them coming up. And so, all the fantastic work, the partners of ASTHO are doing, in my opinion, there is no need to wait for a specific credentialing mechanism to appear. If you have a sufficiently large user base, 1,000, 10,000, million, 10 million, whatever it is, you can go ahead and start issuing these authenticated vaccination cards that are digitally certified. And at PathCheck, but also other organizations can get you up and running. We are a nonprofit, very well funded. So we are, we have a lot of free tools, but also we have professional services, and we can help you get up and running right away, in a matter of hours. Next slide. And this slide might be a little bit controversial for some of you. So, my intention here is to really provoke and make you think in new ways. I think there are 4 main challenges for seeing credentials in the US ecosystems. One is standards, ecosystem complexity, business models, and equity. And very quickly, when you think about standards, there is an unnecessary wait right now for a common standard to emerge from assurance side so that verification can become simple. I think this is wrong. I think this is a mistake. And right now, we do not need any standards to create new types of QR codes that are digitally certified and get going right away. And we can transfer the complexity to the universal scanning app that will scan these QR codes. And that can handle complexity, even if there are no standards, even if there are no interoperability. So again, right now, we do not need standards to get going. I think all entities can start issuing their QR codes to their residents and move the complexity to the software. In fact, at PathCheck, we're launching a universal scanning app, so it can work with any one of those QR codes in the world. Second is that some players are trying to enforce the use of blockchain and EHR and identity ecosystems. We think this is not necessary. We should think of the credentials as an output of all those ecosystems, not an entry point, not a lookup into the EHRs and blockchains and identity systems. And that way we can minimize data collection and there'll be no audit trail because there's no way to look back. In terms of business models, of course, we want business models to emerge, but some are pushing business models that are based on cloud services or paper verification or exploiting the streaming data. And this is great, and there's nothing against it, but in the short run, it's slowing us down. So if you use this offline solution, which is nearly free for everyone, and if a state can spend just tens of thousands of dollars, maybe $100,000, they can launch this solution overnight. In terms of equity, obviously, access to smartphones and also unnecessary data collection for vulnerable population or undocumented communities is a major challenge. Again, by using a offline mode eliminates all these issues, and with selective disclosure, just disclosing the initials. Next slide. So if you go to pathcheck.org, and I'll post the link in the chat here, you can look at all these possibilities and download the demos and start playing with it. And I'll stop there. Thank you.
Thank you so much, Ramesh, for sharing your thoughts and insights on the work that you do. I really do appreciate that. And I want to actually just to move the conversation along to our panel discussion. So if you don't all of mine just to put your video back on, and so we can actually have a conversation. And now for the audience, throughout this discussion, please use the Q&A chat box to submit any questions you may have for our audience Q&A that we would address later in this session. So, you know, hearing what everyone has had to share about vaccine credentials is really interesting. You know, Karen, actually, she touched on this in her piece. You know, a recently published Washington Post article that I read a couple of days ago, it focused on vaccine credentialing, and it raised a few concerns in developing the technology, such as protecting the credentials against fraud, data security, and data privacy. I know Karen touched on this, but just as from a panelist perspective, what are your thoughts on these concerns, and you know, how would you address them?
So I can start. I think, you know, from my perspective, and I did touch on some of this already. So I think that, you know, there's really three key things that you have to be able to confirm when you're looking at any kind of credential. I've got to be able to confirm that I know this was issued by someone who was authorized to issue it, right? If anyone can issue a credential, then all of a sudden you're going to have lots of credentials that don't mean anything, right? There's no security behind them. So I've got to be able to authorize that issuer, and doing that involves a link back to, in some way, the government authorities that license healthcare providers, right, for the ability to do testing, to do vaccinations. And so it can be, you know, that's one thing. You've got to have that trust in the issuer. Then you've got to have the trust in the data itself. So I know that the data is what that issuer issued. It has not been changed, tampered, edited. That's where blockchain technologies do support this well, where you can have the sort of the immutable record that is stored on a blockchain, and it doesn't have to store the data itself. So you're not repeating the data, you're putting a hash, sort of a DNA fingerprint of it.
Right.
And when someone verifies it, even in an offline kind of environment, you're just confirming that nothing has changed in the data that was secured in that code. The third piece is that you have validated that the person who is presenting this to you is the same person it was issued to. So it's really the identity proofing of this, and providing for the identity proofing. You know, it can be as simple as having a passport ID or a number or a driver's license number, but some sort of unique identifier that the verifier can also double check to validate. It could use biometrics too. That certainly will create, you know, more concerns in many places as well, though.
Right.
But those are really kind of the three key things that I think are critical. And I think that the other piece that struck me from the article was the debate around who should issue the credentials.
Absolutely.
And it seems to be that there's a bit more of a push in the U.S. to it being a private-led initiative, and which I think that technology and private companies like ourselves and healthcare providers, you know, we all can take key roles here, but it's that having a sort of baseline of what is required to make it acceptable from the government, I think, is important. Having the baseline from the government authorities on who should be allowed to issue the credentials is important. And when you already have a system of record, like an IIS system, you're going to have better equity, better coverage for every single individual who may need or want to get a copy of their vaccine credential in a way that can be verified.
Right.
If you have a reliance on them figuring out and finding out who to get it from, or on every healthcare provider having a way to issue a credential, then I think you create more of a risk of inequity. And that's, to me, one of the things that's important for inclusivity. So it does feel to me like there's a role that the public health agencies can play across the states to help support this.
Absolutely. And I appreciate you bridging that to my next question is about equity, and really how do we operationalize equity in the development of these tools and technologies. And I think Kevin touched on that as well regarding, you know, not everybody has access to a smartphone. Not everyone has the available resources that you need to kind of proceed in this verification process. So could you guys just touch on that at all? How do you operationalize equity as we develop these tools?
Well, I think, and I don't mind jumping in on this, that there are lots of elements to achieving that. Zeeshawn, you know, Zebra's background certainly in secure card or manufacturing gives us an insight into this, because the same kinds of credentialing, security, and privacy protections that would exist in a smartphone app will exist there, but it has the benefit of being more readily available and is not dependent upon the recipient having a particular precedent technology on hand. And so I think lots of options to achieve the same thing is one of the ways that equity on a practical basis can be achieved. And just reiterate the point I made at the beginning of my comments. If we're going to have the public, and I speak as an elected official, if the public is going to not only have confidence in the technology, but accept it as a methodology, equity is one of the key things the public's going to use to evaluate this.
Absolutely. And Ramesh, if there's anything you'd like to add in this conversation.
I think it's such an important question, Zeeshawn and Karen and Kevin. I mean, half the world's population, does not have smartphone. And even in the US, a lot of the vulnerable population who are the ones who are essential workers, are at the front lines, often do not have the latest smartphones, may not have data plans and so on. So I think having, some kind of a paper credential is critical. And Karen gave a great example. I mean, when you see $100 bill, you trust it. Yeah. In addition, if you have a digitally signed mechanism, and we use this, the back of your driver's license, your national passport already use this technology. It's a very mature technology. And so we should be able to use these digital signatures, which are tamper-proof and immutable. And so pretty straightforward. I mean, when you have a $100 bill, it doesn't latch back to a blockchain or an EHR or any complex system. And the $100 bill is sufficiently anonymous for somebody to carry around to demonstrate they have the $100 bill. So I think we need to kind of simplify this problem and be very, very practical about it and say, hey, you got vaccinated? Let me give you this piece of paper that has a QR code that cannot be tampered with.
Yeah, I'd like to simply add to that point. There are physical limitations to paper that cause us at least to certainly urge more of a traditional PVC plastic smart card. The ability to counterfeit and the durability. Anybody who's ever put a paper card in their blue jeans and then thrown it in the wash unintentionally knows what happens. And so I think from an operational perspective, Zeeshawn, and no disrespect to what Professor's saying, is that there are lots of methodologies to get there, and we can make a case that a freestanding secure card made of PVC is got some really great advantages.
No, yeah, please.
Just, I mean, I think the point really here Kevin is making is we should reach people where they are.
Mm-hmm. That's right. That's absolutely right.
If they're comfortable carrying, sticking it at the back of their driver's license and just carrying it around, that's great. If they can just fold it, keep it in their wallet, that's great. If they just want to take a picture of the QR code and put on their phone, that's great. If they want a fancy app delivered to them, we should be able to reach people where they are. But the technology is just based on a QR code, which does not require any significant standards to get going. At the same time, very quickly, hopefully in the next few weeks, next few months, we should be working towards a common standard to simplify the complexity of it. But right now, there's no need to wait for any jurisdiction to go ahead and start creating their own digitally certified QR codes.
That brings an interesting point too, when you're thinking about the role of the standards, right? Because we can launch something today. There's going to be multiple solutions in the market, multiple ways that people are going to be receiving their credentials, whether it's issued by their local government, it's issued by a healthcare provider. It's going to vary from one country to another around the world, but we're going to have to be able to verify a credential from someone traveling from Singapore to the United States and vice versa. So one of the important pieces is that whatever is provided is open, and in that it can be verified and people know how to verify that. And I think we'll start to see tools and apps that are sort of the generic tool that can verify against different standards that have been applied for, or technology approaches have been applied for a given market. And I think that when we have a digitally secured credential, it can be something that the QR code is something that if you have the right kind of technology, you can trust the code, trust that it hasn't been tampered or edited, and still be able to manage that code as an asset, whether I have it as a PDF on my phone, or I have it printed on a piece of paper, or I have embedded in an app, right? Yeah. Or embedded in a chip on a card, right? Because I think that For some people, the card will be important, but you do have to be able to have a way to expire or revoke the validity of a code in the event that A, it needs to expire from time, or B, there's new information that might arise that lets you know that a third vaccine booster might be required, or new variants are out, so this vaccine is no longer valid. So you need enough information to make those kinds of ongoing decisions.
Absolutely. No, absolutely. I think that, Karen, you make a really good point, especially regarding the expiration of these things. And I wanted to actually, in the interest of time, pose a question from the audience. It actually relates to this. So the question reads, if we use paper only to start, are there any suggestions how to address all those who already got vaccinated? Or is the issue with whether a vaccine might expire, and since we learned protection wanes, how could that be built into paper?
If I can jump in there, actually the process is relatively straightforward. I mean, most states have an immunization registry or pre-registration systems. Many employers have Excel spreadsheets of the employees that they know have been vaccinated. So there are many mechanisms for people to kind of issue this, QR-based credentials. And again, I just want to be very sure. I mean, I use the analogy of the $100 bill, but it's not an analog document. It's a digital document in the sense that it's immutable, right? The QR code has a digital signature in it. And so if you're a large employer, I don't know if you're, you are a big mining company, or you're a big automotive company, and you want 50,000 of your employees to get these credentials, they should go ahead and do it. And they just say, we have already signed it with our private keys. And by the way, this is our public key. I'm Ford, and this is my public key. And I'm Petronas, and this is my public key. And you can validate my employees with this public key. And this employee can travel from Indonesia to any part of the world, right? Or from Brazil to any part of the world. And anybody can validate that this person, as long as they trust, Ford or Petronas public key, they can validate this person is vaccinated. Yeah, and it could be a small hospital that has, 2,000 employees, and they can do that. So, again, just to answer your question, it doesn't matter if you have been vaccinated already and system wasn't in place, or you're going to move forward. There's no need to wait. We can go ahead and start issuing these credentials.
Yeah, Zeeshawn, I'll simply add on that, that there are lots of options on a logistical basis to get different kinds of credentials to people who have already been vaccinated. There's a mail option that you can register through a website or call into an 800 number. There are plenty of ways to do it. We distribute driver's licenses in this country largely through the mail. Yeah, and so there are plenty of practical ways to do it.
If you can send stimulus checks, we can send, credentials.
If you still, maybe you tie them together. Maybe there will be more incentive for it. How about that? So we have about 3 minutes left. I think we can answer one more question. We have actually about 10 questions posted on our Q&A. I'm going to see which one I can maybe read real quick. Can you discuss how vaccine credentials could be used in concert with public health agencies' response around monitoring and allocating resources appropriately, such as number of vaccinations administered and/or making decisions on travel, events, etc.?
I can address that very quickly. So the benefit of this Veriscan apps, these apps that are scanning it, also become effectively a triangulation scheme. While maintaining privacy, you can create aggregate information saying, hey, looks like I'm meeting people, a lot of people are going to a pub versus a lot of people are getting on an airline. So it gives you kind of an economic thing. Or you can say, hey, a lot of people are showing up only with their first dose, but not the second dose. So it kind of gives you, it's like Waze or Google Maps, to understand the traffic on the streets, you only need about 5% of the people to use those GPS, tracking apps, right? Mm-hmm. Similarly with credentials, even if 5% of the people are being observed in an aggregate manner, it'll tell us how the overall, deployment and flow is working.
Absolutely. I think, thank you so much, Ramesh. And I know we're actually very pressed for time. We're about 1 minute left. So I actually want to go close this session, but I really want to thank all of you, Ramesh, Karen, Kevin. Thank you so much for joining us and participating. And I really genuinely learned quite a bit from all of you about this topic. And thank you so much for the audience present. I really appreciated the very engaging questions. Sorry we couldn't address all of them, but I believe if the presenters would like to share their email contacts or whatnot, I'm sure we can have some of those questions addressed at some level. The next session that's scheduled is a closing plenary session about COVID-19 challenges and the innovations we need. And that is going to be led by our very own JT Lane, the Chief Population Health and Innovation Officer here at ASTHO. So thank you all so much. We're at 4:45. It's been a pleasure. Thank you so much.
Thank you.